Welcome to the ReFit training video with the V-Form handpiece. Please review this training video after reviewing the V-Form basic contouring training. The ReFit protocol is specific for patients after excessive and rapid weight loss due to dieting and exercise or by surgical and aesthetic intervention such as liposuction or laser lipolysis or postpartum. Patients that are suitable for this treatment are those exhibiting loose skin on the body and have reached a stable weight. The weight fluctuations are limited up to plus or minus 2 kilograms or 5 pounds. The treatment expectations are skin tightening and texture improvement. However, please note that this treatment cannot replace a tummy tuck, but it may prevent it if the patient is pleased with the improvement. In the case a patient also has stretch marks, please follow the VST and/or the VFR treatment protocol. In addition, it is recommended to use the ReFit protocol during the last 2 sessions of cellulite, contouring, and circumferential reduction treatment courses. Before beginning the treatment, be sure to have your patients fill out the informed consent form for the V-Form handpiece and review all contraindications for the treatment with the patient. Review the V-Form ReFit protocol document. The etiology of redundant skin after weight loss is different from typical redundant skin due to aging. However, when we gain weight, the skin expands and remodulates to accommodate the excess fat underneath. The connective tissue of the hypodermis stretches and contains a high amount of cross-linked collagen. During typical aging, the collagen becomes rigid, mainly in the dermal layer. So when we lose our weight, the skin remains enlarged, which leads to redundant skin, and also in many cases, the skin develops irritations and stretch marks. These symptoms are exacerbated even more when weight loss is rapid, such as postpartum. When targeting loose skin in aged patients, we aim our energy to the dermal layer to promote collagen remodeling and fibroblast stimulation. But in the case of loose skin after weight loss, targeting the dermis is not enough since most of the stretched connective tissue is in the hypodermal layer. Therefore, the ReFit protocol uses only mode 4. In this mode, 1/3 of the energy is at 0.8 MHz, targeting the subcutaneous rigid and stretched connective tissue, and 2/3 of the energy is at 1.7 and 2.45 MHz, targeting the dermal fibroblasts to stimulate neocollagenesis. Using mode 4, we are able to produce a skin tightening effect of the dermal and hypodermal skin layers. The ReFit protocol consists of 2 simple phases. The first phase is the preheating phase, identical to the typical contouring protocol, and the second phase is the skin tightening phase, aimed for fibroblast stimulation and collagen remodeling in all skin layers, the dermis and hypodermis. According to the treatment area and size, choose the suitable applicator size. Please note that the ReFit treatment can be performed on all body areas including abdomen, thighs, buttock, underarms, and back. During phase 1, the preheating phase, we heat all skin layers. Therefore, set the system to mode 4, set the vacuum intensity according to the test results, and RF intensity to at least level 2. Preheat the skin to the clinical efficacy temperature of 39 to 42 degrees Celsius in the same manner like in the basic protocol. Once the entire treatment area has reached the clinical efficacy temperature between 39 and 42 degrees Celsius, move to the second phase, the skin tightening phase. During this phase, we stay in mode 4 in order to target all skin layers. Decrease the vacuum intensity to level 1 and set the timer to 14 minutes. Heat the area the same way as in the contouring protocol, moving from zone to zone while keeping the skin temperature between 39 and 42 degrees Celsius. After the treatment, the treated area may show temporary signs of erythema and slight edema. These will resolve during the next 30 minutes up to several hours. The treatment course is on average between 8 to 12 sessions, depending on the initial skin condition and patient's response to the treatment. The treatment intervals are between 2 to 4 weeks, depending on the age of the patient. Younger patients can be treated every 2 weeks, while older patients every 3 to 4 weeks. Treatments generally take 20 minutes to perform. The maintenance of the results is a single treatment every 3 to 4 months on average, but in some cases the maintenance may not be required if the patient keeps a stable weight nor experience additional weight gain or loss. In most cases, the age of the patient, but also the age of the loose skin, will influence the number of treatments, meaning how long the patient was with gained weight before losing it. If the loose skin is due to pregnancy, the age of the loose skin is relatively short. But if the patient was overweight for many years and just now lost the weight, the age of the loose skin is much longer. In the case where the patient has both fat accumulation and loose skin, and we are not sure which protocol to choose, the contouring or the ReFit protocol, we first need to ensure that the patient has reached their target weight. In the case of weight fluctuations or dieting, don't start the ReFit treatment. Start with the contouring cellulite protocol and finish 6 to 8 treatments. When contouring is achieved, wait an additional 1 month to ensure stable weight and only then start the ReFit treatments. On this before picture, we can see loose sagging skin, and after 4 treatments, we see a wonderful result. On this before picture, on the underarms, we can see loose, lax skin, and after 4 treatments, we see a great improvement. On this before picture, we can see loose, sagging skin. After 6 treatments, we see a wonderful progression, and after 10, we see an amazing result. Thank you for watching the V-Form training video for ReFit, and be sure to follow up with Viora's clinical team if you have any questions.